Okay.
All right.
When India was in first lockdown, a lot of discussion happened about what would happen to our nation after the lockdown is lifted. And the reason? Our humongous population, which undoubtedly is a prime reason for the dangerous spread of the virus in the second wave. According to United Nations, by 2050, our population might reach to 1.5 billion, and we might become the most populated country in the world, surpassing China. For a developing nation like India, this alarming rate of population growth is a bane. When I think about the reason for this growth, one major reason is a lack of awareness about sexual health, use of contraceptives, and no proper sex education amongst our masses. Hello, everybody. This is Sruthi Medarametla bringing you an interesting conversation with Dr. Prateek Makwana, an clinical embryologist as well as a social media influencer. Do listen to him and know about the things that are silent but have to be spoken. Hello, sir. Firstly, thank you so much for adjusting this interview in your busy schedule, and it's a pleasure to have you with us today. Warm welcome to you.
Thank you for having me, Shruti.
Uh, Before we dive into the topic, we want to know more about you in your own words.
All right. So I am an embryologist. I practice reproductive health and infertility. I provide treatment for people who are looking for IVF or who are dealing with infertility. And I have a social media handle where I talk about sexual and reproductive health. And I try to spread as much awareness as I can through that. And I hope that it reaches a lot of people.
And we know how busy your schedule is, and uh, s- getting into social media takes a lot of effort. So, I mean, you have to make time for everything you do. So, why at first place did you think of starting an account and taking so much of pain and spreading information? Is there any
So
reason?
actually, I was planning on it for a long time since my MBBS days, but I
Yeah.
had no idea how to go ahead with it. So then when I started my practice in infertility is what I came across is there are a lot of misconceptions. There are a lot of myths. Patient come up with doubts, which shouldn't even exist in my opinion. I mean, this is the amount of myths that we have. So I thought, and people who are educated enough, even they have these doubts. So it's very surprising, that
Yes.
such a strong myth, that
Exist.
whole line goes for years. So I thought, why not just use what I have, use the platform that I have. Obviously I won't reach as many people because a lot of people don't have access to internet, but I thought maybe if I can help in any way I can, I should do it. So that is the whole reason I started my social media account.
That's actually awesome, sir, because I mean, you just said you can't reach people, but you've had almost 10,000 of followers, and I am sure none of us will have, that kind of information. Like everybody, all of us have myths, even we're educated also. So, yeah, that's a
True, true.
awesome
All of
job that you're doing. And so, firstly, I want to know your view between and the link that you think is between population explosion and sexual health awareness. How do you think are they related?
right. I mean, there's of course a link between them because you know what happens. The population explosion in India is huge, right? India cannot handle it economically or financially or even socially for that matter, right? There's
Yes.
just a lot of the population explosion has been drastic in the last few years, and I suppose one of the reasons is that people aren't really aware about birth control or about family planning. I mean, not even people who are in good economic conditions. I mean, consider people who live in really backward areas which don't have access to all this awareness programs or camps, and that is essentially the majority of India. That
Yeah.
is one part where we really lack is to actually create awareness on that side, because they are the people who probably don't even know that there's a thing called as birth control.
Mhm.
They aren't even aware कि हाँ हम we can try and just limit our family to two. They don't even know such a thing exists. And I have come across people like that, and it's
Okay.
surprising, but it's also really sad. So yeah,
Acha.
that is probably one thing why there's a lot of population explosion.
This brings me to the next point. As you said, there's this irony in rural areas. Like people don't know about birth control and the measures, but they do have children, irrespective of their conditions. Like they can't bring the kids properly
Right.
and all. Why does this happen? Is it also because of ignorance? Yes, they don't know, and is there ignorance about it, like not
I
being
mean, I
responsible?
wouldn't, right. I wouldn't say it's ignorance, because see, if they were, like if they had access to birth control, they probably might use it,
Mhm.
but they don't. Plus, there's like a thing, where people in these backward, or areas which don't have access to normal camps, something like, they get married really early. They get married, they they marry their girls really early. There's very, the maternal age is really low. It's like people at 20, 21 having kids, and by 25 they have 3 kids. So things like these also add to population explosion. Just the awareness, lack of awareness, essentially, low maternal age, getting married really early, all this adds to it.
And how big is the role of superstitions, religious beliefs, and in this whole scenario?
Right. I don't know if it's the role of superstitions, but I mean, there's obviously a thing, like in the whole area, it's like, you should have kids. You're married. Ab humko bacche chahiye. Shaadi ho gayi, bacche chahiye. It's like it has become a milestone. It is not a
Yeah.
milestone. Should not be considered a milestone. But this is I think this is the country we are in, and this is how it has been. Maybe that's why it's so deeply embedded in people's mindset, that ये हो जाता है. I mean, people would like, अच्छा शादी हो गई, अब तुमको बच्चे चाहिए,
Yeah.
and then there's one bacha, and they're like, a family complete karo, then दूसरा बच्चा, and then
Yeah.
the third one comes along.
Yeah.
So that keeps adding on to it.
And then there's like the girls born, then that wamsh is not taken forward,
Yeah,
so they wait for the
right.
guy to be born and have a
Which
lot
is
of.
which is really sad. Which is really
Yeah.
sad. I mean, but that also happens, unfortunately, in our country. That continues to happen. I hope it. I hope we understand it better.
Yeah, our
People get the
generation.
sense. Yeah, I
And
hope so.
also, sadly, there is mockery when we say about sexually transmitted diseases. I mean, there's some kind of, joking also happening. Maybe people don't do it intendedly, but HIV is sometimes a joke. People crack, "Arey, HIV aa gaya kya?" Aisa. So if we have to really create the awareness of how serious these STDs are. So what are the biggest facts and myths about sexually transmitted diseases that you want to say out loud and break them right now? Are there any?
Right. I mean, yeah, there of course are, because STD is such a topic, such a which nobody wants to discuss in open.
Hmm.
And even if someone has STD, they probably don't want to come forward with it. They'll be like, "हाँ, maybe ठीक हो जाएगा यार, क्या करेंगे?" This happens a lot, and they only visit a doctor when the situation has become really worse. Then that's the time when they actually come and visit a doctor. But there are a lot of myths कि कोई भी birth control ले लो, STD नहीं होगा. ऐसा नहीं है. There's only one birth control which is even minutely effective, or which, if used rightly, that's a condom. If you use a condom properly, you might avoid an STD. Plus, you know, uh, there are myths like STD might only spread through just sex. No, STD can spread through skin to skin contact. There's syphilis, there's herpes, a lot of things. It can spread to oral sex, it can spread to a lot of things. So people need to understand that. Also, people need to know that STD might not always come with symptoms. Kabhi kabhi you are asymptomatic and you will keep on transmitting it, but you won't even know.
And
These are some very, very big myths.
and does this lead to quackery, sir? Because they don't want to get diagnosed or go have a check, and later they recognize and don't come to you and go for some other quacks and all. Does it happen? Choosing
It
other
does, it does,
alternative medicine.
It does. Actually, I mean, with STDs, not so much, like not so much that I have seen, but I'm sure this happens a lot in a lot of areas. And it does, I'm sure it does, because when people come to us, I have seen this like 50, more than 50% of time, that people who are coming with STDs, they come at a very later stage. Okay, fine. There are people who are aware, and they would essentially know when to come, and they would come like very early. But then majority of the people who would come only when symptoms develop and it gets really worse. That is when they'll come. So tab tak they'll try everything that is possible, but they won't visit a doctor.
Mm. Okay. Moving forward, what do you exactly mean by sexual education, and do you think it has to be included in Indian school curriculum, and why?
I am very pro sexual education because people confuse sexual education with sex. It's not. There's a lot that goes into sexual education. There's gender identities, there's reproductive health, there's reproduction, there's sexual anatomy, there's knowing what you like, a lot of these things is emotional, emotional sort of thing which goes into sexual education. So especially, and this one really important thing is when you know when to say no. That is a very important part of sexual education. So it is really important, and I think it should not. I mean, I think it should be implemented in schools, but as well as homes, because they are sort of the first area where you'll be exposed to it.
Yeah.
And I think it should be, because if you don't get it through the right sources, you are most definitely going to get it through the wrong sources.
Yeah.
So you should know at a very early age which one's the right, which one's the wrong, because otherwise you'll just, I mean, there are sources like their friends, there's porn, there's so much wrong exposure there at such an early age, is what I mean. That you will get exposed to it at 14, 15, 12, 13. I mean, itni age bhi bacche get exposed to it. So it's better to expose them to the right things. Better to make them aware, so that they grow up to be responsible. They practice safe sex. They know what their identity is. They know what they like, and they don't judge or discriminate against anyone.
I still remember in our 8th standard when that reproduction chapter comes on, and our teacher used to be like, don't ask any questions in this chapter, and she used to rush through that chapter always. And it used to be really confusing, and it used to be weird actually. And recalling that episode only makes me feel funny. And yeah, we are not even comfortable talking about these topics with our parents, sadly. And I think I hope someday that day will come also, maybe.
Let's hope it does, because thankfully I had a really good ma'am, and she was very welcoming of this chapter, sort of, and then she made sure that she explained it to us very scientifically, so that
Okay.
we all knew what we're talking about. But I mean, I have had teachers in my schools who have been very hush hush about this whole topic. So it's very common. It's very common, and unfortunately, it even happens today.
Yeah.
So
And when the puberty hits, everything is very intense. Like emotions are heightened,
right.
urges are heightened. So, and the society doesn't address them because of that shyness and secrecy around the topic. So
True.
obviously we look at internet for the answers. So do you think this leads to misinformation being conveyed to the youth?
Right. I mean, there are two ways to look at it. Right. There's the right information,
Yeah.
and there's the lot of stuff that you get on internet. So I mean, for every good information or every evidence-based information that you have, there are 10 more pages which will give you all the kind of shit you don't want to hear, which you
Yeah.
don't want to see, but you will be attracted to it. You'll go look at it, and that is what your mindset will be. Okay, this is sexual education, or this is what I need to know, or this is what I like. But that's not true. And yes, I think it all comes down to the fact that we just don't have enough exposure to sexual education. Thankfully, I mean, my parents are doctors, they have been gynacs and IVF specialists. So I had that exposure, which is,
Yeah.
I think I'm lucky in that way, but
Yeah.
not everyone does. And that is why, I'm very pro sexual education. Like, we should implement it in schools. Otherwise, we already know where we are going.
Yes. And I'm also curious, is the secrecy maintained in the clinics too? Like, do patients who come to you seeking for help tell their problems in a correct way, in an open way? Do they confide in you completely?
I would say a lot of patients do, and a lot of them don't, right? Because the topic we deal with is infertility. It's a very sensitive issue, okay? And sometimes people are aware of infertility. Sometimes maybe they have already tried some other IVF hospital or you know, so they already have gone through the process and they are very honest with their diagnosis or with their history essentially, so that we can make a diagnosis. But a lot of them aren't, because they would try to blame it on their wives, especially men, कि हाँ maybe इसमें कुछ problem है. But नहीं, 50% in 50% cases men are responsible, or men also suffer from infertility just as much as as their wives or their partners. So yes, people are really dishonest in the beginning, but then you have to poke and prod and you have to get that history out of them. You have to be really good at history taking. You being a medical student, you should know that you have to develop the skill. This is the single most important skill a doctor should have. That's history taking.
Okay. So, and also, do people look at adoption as an option at all when it comes to these cases?
Right. So adoption as an option is actually a very, very good option. Okay. And we try to offer it to people who have reached a stage in their life where they have gone through multiple IVF cycles with multiple IVF units, but haven't seen success, and now have, and now they're like, so they're just not ready to accept that, it's just the situation in that case. Adoption is a really nice option. Not many people in India are open to it. A fraction maybe, which sometimes we get a fraction of people who are like, instead of going through the whole IVF treatment, we might just want to go for adoption, which is nice. It's a really good thought. But the whole point, in India is that हमको हमारा ही बच्चा चाहिए, मतलब genetic material हमारा ही होना चाहिए. That mentality in India has led to people, keep on trying for IVF. Yes, it's good. I mean, sometimes they, after multiple cycles, it's good for them. Sometimes they have their kids, and sometimes it just happens in one cycle, which is amazing. Sometimes it happens spontaneously. They don't even need IVF. But I think people should be more open to adoption. It's a really good option, and they should never be ignored. I mean, there are a lot of kids who need, who can be adopted, and there are a lot of parents who need kids. So I think it's a balanced thing, and people should really should be open to adoption essentially.
And why is sex and stuff like that is a taboo? What's the big reason behind it, do you think? And how important it is to normalize talking about this?
I think it's a taboo because, I mean, you have grown up in an Indian household. I have grown up in an Indian household. Have you ever had this conversation with your parents? No. I mean, has majority 90% of houses in India, they don't have this conversation.
Yeah.
Sex is shown as something which is impure, and it is not. I mean, how did we come into existence in the first place? How did our parents come into existence in the first place? It being so natural, I mean, it's normal human, like normal human sort of thing, that reproduction is very normal part, but people don't see it like that. And the media and the pictures and the movies have projected sex as something really vulgar.
Yeah.
So that also adds on, okay, sex is something really bad. So let's not discuss it at all. That's why we need sexual education, because it covers everything. Sex is a very small part of sexual education.
Yeah.
So yeah, that is one.
Okay. And I'm sure you must have had some funny experience regarding this sexual health and all. So will you like to share something of that sort in your life?
Yeah, there have been really funny experiences now that I think of it. Because I keep getting these questions, which are really innocent questions, but if people had access to sexual education from the schools, they wouldn't have these questions. Something like, like masturbation will make you blind or will make you lose hair. And then we have patients of infertility who come to our hospital, but they come with their in-laws, which is amazing. I mean, how do in-laws know what's happening? But this sort of things happen. I mean, it's really funny, but it's also really sad to see, like people have such basic doubts. I mean, obviously it's nice to just get it out of their head, to help them. But then you come to think of it, it's not, I mean, it's whose fault it, whose fault can we say, because I mean, it's just the country we are in, and people just don't have that exposure. So yeah, there are. I mean, these are some funny incidents I can think of right off my head.
Okay. So yeah, we've come to the end now. And before the goodbye, I once again thank you, sir, for giving us your time. And this is just a light-hearted conversation. And we have tried normalizing the discussion about sexual health
Yes.
and conveying how important it is to be spoken about in this present scenario. And listeners, it's high time, guys. Let's not be shy to get those contraceptives from the shop, and let's
Yeah.
educate ourselves with the right facts. Also, go follow Prateek Makwana sir on his Instagram handle, Fertility Scribbles. He has some just amazing content out there. He keeps bursting out myths all the time. And it's really interesting and important information that we have to know about. And if you find this interview informative, don't forget to like, share, and subscribe to our channel and also our Instagram page to get the most authentic and relevant medical content on your way. Inflame magazine is now on Spotify too. Keep supporting us. Until next time, this is Shruti signing off. 1 second.